Everyone, what is my topic? Bichectomy. We talk about getting improved in the middle part of the face, how to make it easy. This is the goal of my presentation. Only to remind you, the anatomic concept bichat is a ball. Sorry, I need to put focus. Okay. Over there, because my eyes. It's a lovely fat covered with a fine fibrous capsule. This is really important. Another point or advice or goal when you perform this procedure, in a few minutes you will understand why. Have 4 extensions, vocal, pterygoid, pterygopalatine, and temporal. Put the focus only in the vocal, the rest forgiven. It's a position anterior relationship with the masseter muscle. It's really important. It is capsulized in contact with the fibers of the buccal muscle. I'm going to explain why different wave of these fibers is important during the procedure. The vocal extensions lies superficially within the cheek and is partly responsible of the contour. This is for sure. This is the way obtain a one face of a patient, and they look for a solution for that. And this is another clue. It's only 5 millimeters. If you can be successful, excess with her, only is exactly the size of your thumb is good enough. No more than that. Well, who is the best candidate for this procedure? This patient like one face, fat cheeks, patient with the appearance of the convex cheeks, patient who has undergone orthodontic surgery too, because the moment you solve angle 3, you have excessive skin. In this excessive skin, you have excessive fat, and you need to give a solution too. What is the worst candidate? Low and excessive BMA, because in low BMA you can obtain a cadaver situation, cadaver face, and a high BMA, it's impossible to notice your procedure. You take out the fat pad and nobody noticed that. And of course, the patient with overrated expectation, because there is a real headache for us. Well, with this surgical obstetric, that right now you can see here, change one face to triangular face. I give you the advice to take this kind of photos in this position with the upper view, because it's the way the cheek sagging, and you can be a great view of the fat pad. Why bichectomy? Large buccal fat can make the face look round, as I told you. In this case, the cheeks may look out of proportion when you talk about harmony. Harmony faces need to have this proportion too, not only put the focus on the eyes, on the chin, on the nose, put the focus too in the middle part of the face. Well, this is risk associated with the procedure. I want to talk about my complication too: trismus, bleeding, infectation, persistent edema, hematoma, sensory disturbation, prolonged pain, asymmetrical facial appearance, because in some cases it's impossible to take the same quantity from each other's, or in some cases we are complete asymmetry and you take exactly the same amount and the result is not the same. Salivary duct injury, one of the worst. Facial nerve injury, the worst of worst. This relationship, as I told you, always is before the masseter muscle. And at the moment you find vertical fibers, you are in the wrong place. You need to go below that, go a little more front, and return with the dissection, because you are in the wrong place. Always previously the masseter muscle. And again, one way to be sure you don't have any problem is put your scissor in this position, back and up, back and up. And by this way, you can have any problem, especially with the salivary conduct. During the appointment, is help you if you can, during this appointment, show the exactly way that the punctum of the ductus appear. Always is in contact with the second upper malar, but in some cases it's moved a few millimeters, and it's better if you have this first impression. And in some cases, it's easy to see like this, and in some cases you had any, well, I show you the way I squish the parotoid, and I can see the saliva go out from the ductus. I continue. Well, this is a way I can measure how can I be successful with my patient. I ask for that, the kiss maneuver. She make the kiss, and I say, well, I can try to do that with the surgery procedure. She's agree with that. Okay, she is not agree with that. It's not good enough for my patient and not good for me. Well, sorry, can you lie down the voice? I thank you. This is step by step. Perform great tumescent infiltration to allow this fat pad go close to the mucosa, and it's really fast and really easy to when you cut. It's going to be an aeration. It's really easy way to find it and to take out. Well, when incision no more than 1 centimeter, always you need to see the ductus of the conduct of the salivary conduct and go down. Only be by never cut, always dissection. Another way to not have any problem, any bleeding. I go a little fast. I can move that? No, okay. After that, with the clamp, I take the fat pad and make movement to allow more aeration and look for the pedicle to cut it and to make the cauterization of the pedicle of this fat pad. Okay, I continue. I'm going to show some results to give you the possibility to notice if you agree with that or not. First, when it's alone, and of course, I give you again the advice to use the superior view. Another case, always measure the difference between in the middle part of the face, not the other part. Change round to triangle form. And again, here in a half profile view, you can measure well the result. In emails, it's quite difficult because we have barbs and it's not easy to see the shadows and the bright, but you can see here in another view, you can measure well the result. Another view, half profile view. In this patient, I don't see nothing. She don't see nothing of result, even in these positions. But we have the vector system and help us, show us in which way I can be successful. The yellow one is the reduction. The blue one is the gain of the volume, and we reduce a lot with the yellow. Another male, difficult to see the result, even in this high profile view, even in the upper view. But again, you use the vector system. You can see here the yellow one is the part that I reduce. I was successful to reduce. Another case, again, 1 to triangle, the best way in the upper view. I take the color of the photo in some cases to measure really well, and you can see here the depression below the malar area. And again, the result. The beauty of this depression in this younger lady. Again, in the upper view. Another case, another beauty of repression. Usually, female have more consistent of that. They use bright and shadow to prepare for a party, for example. They use shadow in the middle part of the cheek. They use bright in the malar area, where we can do it the same in the surgery procedure. And again, in half profile view, during the time, you can see here the result is not the cadaveric situation, even past 4 completed years after the procedure. In some cases, I combine the procedure with nail liposuction without or with the use of technology like diodo laser and ultrasound cavitation. And in some cases, I add a chin augmentation by implant. Here's the case of the chin implant with the bichectomy at the same time with local anesthesia. Here you can see better the result, and here you can measure better well the way I can get improving the face of these patients. Not only in the middle part, in the lower part of the face too. And again, vector system give a possibility to notice the blue one is the volume that we gain, and the yellow and orange, the reduce of the volume. Gray case, one face to triangular face, sorry. Another measure of the same patient in a high profile view, and you can see here the depression in the middle part of the cheek. Again, and again the depression and the solution in the lower part of the face, in the chin area and the under chin area too. One of my best cases, bichectomy magnetic liposuction, and you can see here the great change in the complete profile view of the patient. Better well when she doing this movement with the face. Some surgical details that I think is really important. The horizontal way that you can find the buccinator muscle gives the possibility to cut it or to open, but when you find vertical fibers, be careful because this is the masseter. You need to go before that, no go back that because you can find the salivary duct.
Un minuto, Fabián.
Thank you so much. I can finish. Two-mesh indentation that I said. Always try to identify the salivary duct. Always devulsions, never cut. Continue with devulsion. Try to find the pedicles. Sometimes it's easy, sometimes it's not so easy. But try to find it and make a good cauterization of that. Here is the cauterization. Over-indication, my mistake over here. This patient that I offered him the procedure and I put filler on the malar area. I make the bichectomy. For me, it's a cadaver face. Well, she's really happy with the procedure, but for me, it's a nightmare because I think I over-indicate the procedure. And here is the proof with the vector system, the volume that again, a volume that I reduce. I look at research, and I find only 8 papers talking about bichectomy in the last 4 years. That was, you can look for that, and you can still publish for that. Can bichectomy be reserved? Was a question by Steve Cohen. I don't know, is over here? No, well, yeah, well, he asked me that when I finished this presentation last year, and he proved that with this article. And I tried to do it, but I asked for my patient to one who want to rewrite the procedure, and I didn't find one to want to do it, even if I say that for free. But I doing that with this male. I try to simulate a bichectomy, and I add filler to resolve this depression. And for sure, I can do it the same if I have a bichectomy to rate the procedure. Finally, my complication, I have a vascular injury. If you want, I can talk it about during the moderation, bleeding and bruising, asymmetry in resection, and abandon of the procedure due to the anatomical difficulty. Take-home message in the final of my presentation: easy and safe procedure, low complication rate if the anatomical structure are taken into account, single or combined procedure, avoid extremely high and low BMI, avoid complication in case of anatomical or technical doubt. Please abort the procedure. If you or your patient regret the result, you can solve it by lipofilling. I invite all of you to this symposium next year in March in Buenos Aires, in a beautiful part of our city, in Puerto Madero. We talk about all these hot topics, and for sure, we wait all of you next year in Brazil. Thank you so much.